Thank you both. Congratulations for putting the panel together. It's fantastic. I'm very, very flattered to have been invited to give a talk here, and hope I'll do the topic justice. Disclosures, I've got a lot. That's my job. So I have to say, although I'm a white male and kind of on the face of it would be a kind of a representation of the majority, in fact, everybody's a minority at some point. In my job in France, I'm the only American that works where I work, so I'm a minority there. As I travel around the world, I'm frequently the only representative. In fact, when I went to medical school, I was a token appointee. Went to Creighton Medical School, which was a field of medical students that were white Catholic males. There were 2 women, 2 humanities majors, and I was one of those token humanities majors. So tokenism is part of the course. The world itself is diverse, so it's all perspective and it's all things. My talk, I'm not going to really focus on the women issue or the sex issue or anything like that, and kind of hopefully give it a little broader context. It's an interesting, diversity is kind of an interesting sociological phenomenon, and I think the tension, the reason that kind of makes people's blood pressures rise on both sides and causes defensiveness and causes militancy and enthusiasm is in fact because of that. You know, it's a sociological phenomenon. The world's diverse, and yet humans are tribal by nature. You like to hang out with your own, you like to look like your own, you like to do the same thing as your own, and that's normal. That's a biological thing. Kind of leads to a lot of contentiousness, leads to friction when that plays out, and a lot of the tensions in the world because of frictions between tribes, frictions between different diverse or non-diverse groups, and we're all very aware of that. Sometimes that's actually a positive movement. That can be a motivator for social change, and this kind of is a good thing. This is kind of one of the things that leads to change, and that's actually kind of the message I'd like to convey with my talk, is that diversity and that inherent friction can actually be a positive, constructive thing to kind of drive society. Certainly in Europe, where I work these days, it's a major issue and a major social disruption. So in the context of kind of our day-to-day life, diversity and kind of studying diversity and dealing with diversity has become an industry. It's become kind of something that we all deal with and put up with. It's our institutions kind of send us to feminism courses or whatever, and you know, it gets a little bit overwhelming sometimes, and certainly can go a little bit too far. I think for surgeons, though, you should embrace this. I think we really have to accept that, because this is an extremely important topic and issue for surgeons and for surgery in general. You know, right now in the United States, we're a little victims of kind of a lack of diversity, if you will. This is kind of our president and kind of a representative here. How many women do you see or minorities do you see in this crowd? 0. Was there 1? Oh, yeah, good spot. It's okay, I believe you. So why is that important? Well, they impact our job because they make policy. Reimbursement policy, kind of medical policy, coverage of things. This is a picture from last year of a debate on women's rights issues in healthcare, national debate, and there's no women at the table. Crazy, right? But that impacts kind of our life on a day-to-day basis. Industry kind of knows this. Industry embraces diversity. You know, I think, unfortunately, our government maybe not, but industry kind of knows that in the end this pleases customers. It gives a more effective workforce. It gives a better basis for doing it, and in the end, for industry, it leads to positive revenue streams. That's why you kind of have this industry of diversity education and things like that, because it affects the bottom line. It's the same for our hospitals. I think for me, as you guys know, I like change. I like disruptive things. I like to be in trouble all the time. I think one of the reasons to embrace diversity for surgeons is to get out of this thinking the same thing. The problem with the tribal thing is you not only look, everybody's all wearing leisure suits or has mohawks or whatever, but you tend to think the same things. You seem to get the same news feeds, read the same thing, you tend to think the same thing. So you hang out with the same looking people, you tend to not make much progress as far as advancing ideas. So if you're thinking like everyone else, you're really not thinking in a creative and constructive and forward-thinking manner. I really believe that innovation in any field, but particularly surgery, which is a fairly conservative field, comes from disruptive thinkers. So this like thinking does not advance surgery. Surgery wouldn't change one iota if you sat around from the people that trained in the same institution in the same way and didn't have outside influence or different perspectives to present. So this is kind of an interesting sociological book. Hard to see a situation clearly if you've already made up your mind how to feel about it. And that's, you know, it's all perception. So surgeons aren't closed-minded per se. It's kind of what input you get that kind of leads to a cascade of thinking that can change what you do and, in the end, how we treat patients. So embracing diversity, in fact, makes sense from both a social and economic perspective. Obviously, industry knows that, so we should adopt that as well. Besides that, it's just ethically a right thing to do. Future advances in surgery, I'm certain, will come from input from individuals who look at things differently and from societies, surgical societies that is, that embrace these alternative views. So I think it's very important for a society like SAGES to do things like this because it shows an openness to embrace different viewpoints. It's not really a women's issue, it's not really a race issue, it's not really a sexuality issue or anything like that. It's different perspectives, it's different ways of looking at things, and it's not having those societies shut those ideas down, shut those forums down to kind of be able to present those. That's an open door for disruption. Disruption is evolution and progress. I think the easiest way to integrate those divergent views, you can bring disruptive people in, me or Michel Gagne or any of the numbers others that are always in trouble and introducing new ideas, and that's kind of fun in a way and entertaining. But the easiest way to do that is by actively searching out and integrating members who look different or have different thoughts or different backgrounds and actively pulling them into the picture. That's an automatic thing. It's easy, and it automatically brings a different perspective. So it doesn't necessarily have to be a traumatic, disruptive individual or anything like that. It can be just bringing people in who look different, come from different backgrounds, and that's quite easy to do. You know, I think this is going to take a proactive effort. It's not a natural thing to do, but with a little bit of planning, a little bit of institution, I think it certainly is doable. And even though it may not always be apparent that you're making that active change, simply by opening that door, making those proactive efforts to bring other people in that look and think differently, will do it. John Kennedy said, if we cannot now end our differences, I think that's biologically impossible. At least we can help make the world safe for diversity. And I think this is an effort of SAGES to kind of make a surgical organization safe for diversity and diverse thinking. I think often there's kind of resistance. You know, I think kind of the dominant groups sometimes feel a little bit threatened by efforts like this, but I don't really think that's necessary. And in defense of kind of I'm a minority in this room, actually. I have to say that there is a role still for old white men to do things and make progress. Thank you very much for the opportunity to express some thoughts.